I had had an accident several years ago when I was very young. And as a result, they had to do root canals on all of my teeth, top and bottom, because my jaw was broken in 3 places. But what happened was those root canals all ended up abscessing, so they had to take them all out. And that was very painful. So then having a top denture was not a problem. But the bottom, having a bottom denture was really hard because it was shifting in my mouth. And when I'd bite down, one side would go up and the other side would go down. But I just said, okay, I won't deal with it anymore. But then the problem came up that I couldn't swallow well because I wasn't chewing my food. But we thought it might be something else at first, so we did the esophagram and all the stuff they do, and nothing was wrong there. So then my doctor said, it's time to go see the dentist and see about doing implants. And so I met Dr. Rogers.
So when Pam first came to see us at the ABQ Dental Implant Center, she had been struggling with traditional dentures for quite a while. She had an upper denture and a lower denture, and we see it all the time. We see patients that come in struggling with dentures, but specifically lower dentures. There's not a good way to keep a lower denture in place that's comfortable for most people to chew with. And so she'd been having a hard time functioning with that lower denture. It was difficult to eat. She was experiencing some digestive issues that she was working with her physicians on to try to diagnose and figure out. It turns out a lot of those issues might be tied to her inability to chew her food, which is pretty typical for patients that have dentures. It's really hard to chew food thoroughly when your teeth are moving around. And so she'd been experiencing that. It was affecting her health. And so what we were able to do with Pam is place 4 implants on the bottom and create a set of teeth that are attached to those implants that don't come in and out. And now she can eat everything she wants to eat and do it well and not have to worry about teeth moving around, coming in and out. And she can feel comfortable and confident with her ability to go out with her friends and chew the things she wants to eat. And of course now, she's not dealing with the same digestive issues that she'd been dealing with for years.
One of the big problems I had with my dental problems was anxiety. I was afraid of a dentist because dentist pain, ouch, hurt for a long time. And then it didn't always work. So I felt like I was wasting all this time and not being able to get what I wanted. And also I lost the taste of food. You know, you never realize how important that is until you get used to it after a number of years. And then it was just like, and then I catch things in the back of my throat. I wasn't chewing, so it's going down in big pieces. And that was a whole nother issue, you know, because I wasn't digesting food well. And it was awful. It was really bad. And so when I came here and had it done, had the implants done, oh my God, I could eat lettuce, I could eat tomatoes. I could actually taste food again, which was amazing. You never know how much you miss that until you don't have it. When I came in to have the surgery, I was scared. I was really frightened because I thought, you hurt me and I will not be happy. But he said, it's not gonna hurt. I will make sure it does not hurt. And I don't know, they gave me something that relaxed me, and before I knew it, it was all over. And I had teeth in my mouth because they took my old denture and used it for the first temporary implant. And I can't tell you how good it felt to have teeth again in the bottom, you know, where it really feels good. I went home, he sent me home with some pain medication just in case. Didn't have to use any of it, there was no pain at all.
So a lot of patients that come to us that are struggling either with dentures or broken teeth have a long history of having dental treatment done. And unfortunately, a lot of them have some really built up anxiety about having dental treatment done. It's our job as dentists, and especially at the ABQ Dental Implant Center, we really focus on making the experience as comfortable as possible. That starts at the consults. We talk very openly about how we're going to approach the case. We talk about how we're going to manage pain, discomfort, and the big part of how we manage that when we do procedures is sedation. And so most of our patients receive sedation for implant placement, for extractions, and all the work that we need to do to get them teeth that function well. And for a lot of patients, that's a big change because it is more comfortable. It is pretty involved surgery, but we work really hard to make sure it's comfortable for our patients.
Dr. Rogers is now my favorite dentist, but he was gentle, he's calming, he listens to you. Most dentists don't listen. They just say, okay, this is what we're gonna do. Open your mouth, be quiet. And then they do it. But he explained every step of the process to me, and it was really great. And he was right there with me. He says, well, we're all done now. I said, we are? And he said, yeah, we're done. And sure enough, I went home. I remember I went home and I pulled my lip down and said, oh, I've got teeth again. Because when I don't smile big like a lot of people do where you can see all your teeth. But when I talk, you can tell whether I have bottom teeth or not. And it was nice to have teeth again. I don't have that problem that I was having in swallowing. It's made me more confident. I'm not afraid to get up in front of my class and actually tell them what I'm writing about. And I've had people compliment me on my smile. They said, you look so much better, you look so much happier. It's been amazing. And so health-wise, it was perfect. Being with my friends and the confidence you have. You know, you're no longer doing this number all the time. And it's nice to be able to smile and have people say, oh, you have a pretty smile. Would I recommend them? Yes, I would, wholeheartedly. On a scale of 1 to 10, when you're talking about 10 being the best experience and 1 being the worst, this is a 15.